This is Sickle Cell and the Mind, a mental wellness podcast, brought to you by the European Sickle Cell Federation. It's time to reduce social isolation and create new pathways to mental wellness together. You're listening to Sickle Cell and the Mind, a mental wellness podcast, with your host, Leah Lewin.
Hello and welcome everyone. My name is Leah Lewin, bringing you episode 1, where we will be talking about dissecting sickle cell. So today with me I have Jenica, and also Kofi. So Jen, would you like to introduce yourself?
Yes, hi. Thank you for having me. So my name is Jenica Leah. I am the current president for ESCF, and I'm also a sickle cell advocate, and I also live with sickle cell.
Perfect, thank you. And Kofi, could you introduce yourself, please?
Yes, Kofi, Anie. I'm a psychologist, and I work primarily with children and adults with sickle cell disease.
Mm-hmm.
I work in one of the NHS trusts, long name London Northwest University Healthcare NHS Trust, but basically it's in Northwest London and combines 3 hospitals: Central Middlesex, Northwick Park, and Ealing.
Perfect. Okay, so Jen, can I ask, how does living with sickle cell impact mental health from childhood through to adulthood for you?
Loaded question. It's had a variety, I guess, of implications as I've gotten older. So gone from childhood to adulthood.
Mhm.
I think one of the biggest impacts is the fact that not a lot of people know the full implications of sickle cell. So I think a lot of people know, if you Google the scientific description, it's a condition that affects the red blood cells, the oxygen in the red blood cells, which makes the red blood cells change shape. And, it's difficult to flow around the body once that happens. They become hard and sticky and restrict the oxygen. And so with that, a lot of people know of the most common symptom, which is the pain crisis or a sickle cell crisis,
Mm-hmm.
which causes pain anywhere that blood flows.
Mm-hmm.
When I was growing up, I literally thought that that was sickle cell. So I thought, okay, if I can manage to, manage my triggers and, I'll have pain every now and again,
Yeah.
as bad as that is, it's not the worst that it could be. But as I grew older, in my teenage years, I had a stroke, and then I was diagnosed with like hip complications, bone complications, various infections, surgeries, and there's kind of like a barrage of different complications that
Yeah.
actually can cause as a result of sickle cell, and that wasn't made clear. And I think that's where the kind of mental health impacts really kind of they pile up, because you think you can prepare for one thing, but then you're given something else, and then you think, okay, I'll deal with this, and then there's something else, and then there's something else, and
Yeah.
just becomes this snowball of issues and trauma that it's really hard to deal with.
Wow. Yeah, it's definitely far more diverse than I think people appreciate.
Mhm.
Kofi, could you explain for us then how the physical symptoms of sickle cell influence the emotional well-being of those that you've supported with this disease, in a simple way as possible?
Well, one of my colleagues did say that, um, name me a part of the body and I'll show you what complications sickle cell affects
Wow.
in terms of that part of the body. So if you think about it, in very simple terms, I think emotionally, as Jenica has explained, you live with a condition whereby, one, it's very unpredictable,
Mm.
and two, in terms of what can happen at any time and over a period of time, it's very difficult to cope with.
Yeah.
Primarily, people talk about pain in terms of the hallmark of sickle cell disease, but there are a lot of people that I've seen without a lot of painful crises, but do have a lot of day-to-day issues in just trying to manage. And I think that unpredictability is one of the things. You try and get on with life, try and get on with your daily activities. If you're a child, you just want to be in school. If you're a young adult or whatever, you just want to be doing your work. And also teenagers, especially, you just want to be, getting on with your friends, your peers, being as normal as possible. And I think that challenge of trying to get on daily and having unpredictable events, pain, complications, symptoms, whatever, that's where the difficulty is.
Yeah.
And commonly people would have, low mood. Sometimes it's not exactly clinical depression,
Hmm.
but low mood, trying to deal with that, and also anxiety is very common.
Yeah. I guess that's what we see when people suffer with chronic illness or long-term sickness. It's not just the isolation or the disease itself, but it's the impact it has on you as a
Mm.
as a person wanting to live a normal life, but having a lack of control over your own body and your own symptoms.
And also, interestingly, I mean, I've seen some people, being in a family environment, very supportive, but they still feel alone. So, in terms of emotional well-being, is not just being on your own per se. And if you're an adult and you're living on your own, you'd say fine, you need some sort of social support, family support, but you could be living as a young person with your family and you still feel alone
Yeah.
because what you're going through is just unique to you. Um, and I think that is where the challenge is. So the family could be very understanding and everything, but you still feel that you're battling on your own.
Yeah. Thank you. So, Jenica, from personal experience, could you maybe elaborate on that from your perspective?
Yes, I think that's there's nothing worse than being surrounded by people but feeling alone or being lonely. I think that's a really difficult situation to be in, and it's also one where no one's to blame for that. Like it's really hard when you have like a support system who are trying to do the best they can,
Yeah.
and then you have me, for example, as someone going through this experience, and also I can't even say finding it difficult to explain, but just there's just no way that someone can understand how you're feeling. And I think a lot of that comes with some of the treatment for sickle cell as well, or the lack thereof, because there's pain medications, which, if you're in pain, you can take. I definitely found that whenever I was in a crisis, or not even in a crisis, just having chronic pain, day to day pain, or day to day struggles,
Mm.
I find myself getting irritable.
Yeah.
I find a mood change. And some of it is out of my control. So it was something that I had to pick up on. And a lot of it for me became something that I tried to take responsibility and accountability for. But
Mm.
I also think that adds pressure to the condition as well. Taking everything on board and taking the blame and trying to control everything, which is one of my biggest things. Um, Sometimes it's just difficult, and you want to be on your own sometimes, but then you need the support, so you can't be. It's very conflicting, and like Kofi said, it's also very unpredictable.
Yeah, it's difficult not having that control. I think that's a huge factor. Um,
Mhm.
the lack of control, being fine the 1 minute, and as you said, for those around you, it's really difficult to kind of quantify. Oh, but you were fine 5 minutes ago, and now you're in agony. That doesn't make sense. How can you go from that to that, and you haven't got any broken bones? But also,
Exactly.
for the person that's experiencing that, it's really difficult to kind of alter your mind frame so quickly, let alone having to explain that when you're trying to seek support. It brings about lots of uncertainty.
Mhm.
What what do you feel, Kofi? So what role does the uncertainty of pain crisis play in anxiety and depression, for example, for people living with sickle cell?
So I think when it comes to something like pain, probably a lot of people providing, health services like in the hospitals, and they tend to see maybe you coming in when it's your worst, for example,
Hmm.
um, but not knowing that you would have probably had so much to do at home trying to fight or trying to deal with the pain. So your battle that you have been experiencing at home in trying to manage the pain, because you want to, sort of get on with life as well. That sort of unpredictability that we've talked about, but you still want to get on with your day-to-day stuff. And having that interruption and trying to fight it, and then ending up in hospital where sometimes people don't appreciate what you've been through before you got there. I think that makes it like a double, sort of challenge. So you are dealing with it day to day as much as you can, and when it's really very unbearable or difficult to manage, you come into hospital and you may not necessarily get the best treatment that you want. So if you have that as a combination, and I think in terms of the challenge of managing, it makes it more difficult because all you want to do is quickly get better and get back to things, but probably the lack of understanding and empathy, for example, all play into that sort of role.
Yeah. Jenica, from again your own personal experiences, when you're in a crisis, are there any key elements that kind of impact your anxiety or cause depression?
I think the initial uh, acceptance or realization that this is a crisis, number one, is like when the anxiety kicks in, for a number of different reasons. Like many of them Kofi mentioned already, like you start to question, okay, how bad is it? Do I need to go into a hospital? Have I got the right medication to manage it? Because as we mentioned, it can occur anytime, and depending on where you are, like I've had cases where I've been out, I've been in a different city, different country. So you suddenly start to panic, and that initial realization is really difficult. Then once you get past that stage, it's then okay, trying to manage it, and like your brain just starts to think of lots of different things. For me, some of them might even be disappointment because maybe I've had a long run without having a
Yeah.
crisis or without needing to go to the hospital or taking pain medication. And as silly as it sounds, it's like a clock. It's like we cross off the days and we always
Mhm.
celebrate how long it's been since we've had a crisis or since we've had
Exactly.
any kind of issues, from sickle cell. And so
Not
when,
again.
yeah, exactly, you kind of just feel like, here we go again. And sometimes, if I'm speaking from my own experience, you can't help but feel like it's your fault, when it isn't always. But I always go down a cycle of what did I do? Could I seen it coming? Could I have avoided it? And I think those thought processes are what sometimes then spirals me into a somewhat a depression of some sort, because depending on how I answer those questions,
Mhm.
sometimes changes the way that I might deal with it and might manage it. And then you've got the anxiety of going into hospital, which is a whole other like hour-long conversation of how difficult that can be. But just not being believed,
Mm.
getting to the point where you have to go, and then preparing yourself to almost fight, like you're
Yeah.
fighting the pain, but then you also have to prepare yourself. It's like to then not physically fight, but advocate for yourself, prepare for what questions are going to come, and prepare for all of these things. And that, like, it's hospital is actually added stress.
Yeah. Yeah.
So many elements of it that become difficult.
Mm.
I can remember, like, the one thing that I used to hate about going into A&E was that no matter what time of the day I went in, if I went into A&E and I was like triaged or whatever, they always would move me to a ward in the middle of the night. It
Mm.
would happen at 2, 3, 4, 5 a.m. in the morning. And it's like, just when you get settled, sometimes it's the simple things like that, which is just protocol, it's just how the hospital works. But it makes it really difficult for us because that moving, cold corridors, getting settled,
Mm.
then having to answer all the questions when you get to the ward again, and it's like it's 4 a.m. and someone's asking you, have you had this? Where's your medication? Have you got all your stuff? You can't think.
Yeah.
So there's just so many different elements of it that can, I think sometimes we can be our own worst enemy in sending ourselves into those states sometimes, and other times it's other people that can make us feel those emotions as well, that guilt, that what's happening,
Mm.
especially healthcare
I
professionals.
think what is interesting is that, and this is just a natural process. You get into sort of a negative thought cycle without
Yeah,
even realizing it. Because what you've described is, maybe you've been going well for some time, and then all of a sudden, um, you get a crisis or whatever. You start thinking negatively, and that kind of gets you to feel, you know, um, in a bad way as well. So these thoughts of anxiety, depression, whatever,
Mm.
it it kind of like starts with the way, sort of we kind of think negatively, and then it moves on from there. And then also when you get, let's say, into the hospital, your expectations of things not working the way you should, or the experience that you've had previously, all feels into that,
Yeah.
and that changes your mood as well, um, and makes you feel worse, or anxious, and that kind of stuff.
Yeah.
yeah.
Would it be right to suggest that fear is plays a huge role in this as well? Not only fear of the crisis, of the pain that you're now likely aware that you will experience, and having to mentally prepare for that. Also, Jenica, you mentioned about having to fight, but also as a Black woman, it's very difficult. We hear so often through trauma porn and social media that we're the least supported, and we're more likely to have these terrible disparities in healthcare, and we're not going to be heard, not going to listen to. That all kind of compounds the effects, and it adds a lot of fear around stepping foot inside of a hospital where all you want to do is essentially be vulnerable and taken care of and get the support and relief that you need. But like you said, you know that actually this is adding another layer to the battle. how how does that impact mental health? Is that something that's at the forefront of your mind? Is it something you're very aware of, or is it more of a subconscious kind of impact?
I think fear it's one of the biggest kind of like emotions that we go into, and I think not just for ourselves, but as like being a part of the ESCF, and an advocate in other areas across the UK and the world. There's a fear for our lives when it comes to being admitted into hospital. People see hospital as somewhere where you're supposed to go to be looked after, to be cared for, and to hopefully recover and go home.
Yeah.
And unfortunately, within our community, any loss, we all feel it. It's
Yeah.
almost like we're connected, like this big family. Some of us know each other and some of us don't. But even if we've never heard the name before, just to hear of
Mm.
someone losing someone because of sickle cell or because of a sickle cell complication, it's felt. But
Mm.
when there has been recently, and it always seems to be a reoccurring theme of, um, you know, deaths that didn't need to happen, like avoidable deaths that
Mm.
happen for people living with sickle cell just as a result of a lack
Negligence.
of, literally negligence. And you know, it's really that's scary. That is really scary, and it's usually happens in a hospital setting. It's
Yeah.
very rarely you hear of someone that had sickle cell and unfortunately they passed away, but they were comfortable at home, or we always go to the hospital because we're in a crisis and we know how serious it can be. And unfortunately, it's one thing for medical professionals to say there's nothing they can do, but when months later you hear, well, actually this person said they couldn't breathe but no one believed them, this person said they were in pain and they were waiting for hours in A&E, even though there's a protocol that says you're supposed to receive pain relief in within 30 minutes. Those things invoke fear. And I know as a pivotal member of the community and many different groups and stuff, this is a fear that is being amplified at the moment. And every year there's something else, So it is really scary
Yeah.
for a lot of people. Yeah.
So, Kofi, as a healthcare professional working with those that have sickle cell or that are a family member, and they're expressing to you signs of anxiety or depression due to the fear that surrounds crisis and just the condition as a whole, how do you help them navigate managing relationships, taking care of themselves, promoting their own mental well-being, and maybe overcoming some of the misconceptions?
Yeah, I think there's a whole range of um, ways in which people can be supported. But if you look at it, I think fundamentally you need to be able to understand what every individual is going through. So you would probably just start by trying to assess um, that person's situation, and it could be in conjunction with family members as well. So if they're children or they're young people, maybe parents, sometimes siblings as well, and seeing how sort of on a day-to-day basis things are sort of panning out. And then afterwards, it's just trying to identify whether in terms of low mood, depression, anxiety, whether some therapeutic option might be useful for them. So I would look at firstly what you call psychoeducational approaches, whereby it's just basically trying to look at people's educational um, sort of background in terms of the sickle cell knowledge, as well as how they deal with it. So if people have some gaps in their knowledge and understanding certain things, then trying to educate them. And even in terms of children, we kind of do that in a very simple way. I remember when I started years ago working with children with sickle cell. I just used to ask them, what do they know about their sickle cell, and they would come up with all sorts of, incorrect things. So things like I don't have enough blood, or things like that. And I realized at that stage that just basic education and with some very simple psychological tips is the way to start with the children and the young people as well. And then also trying to use that as a means of offering what we call cognitive behavioral therapy is one of the very simple psychological interventions, but very effective. For example, the NICE guidelines in the UK recommend that for almost every sort of physical or mental health condition at the beginning. So using that as a means of just trying to offer them some basic tips, and explaining that our thoughts affect our feelings as well as our actions, and trying to understand and trying to break the cycle in terms of very basic and simple things like that. And then obviously depending on the individual situation, trying to address very specific things. And sometimes it's making sure that they understand, they have the knowledge, but also trying to help them to address specific things that are happening in their lives. Sometimes it's very difficult, or it takes a long time, or it may not necessarily be in my remit. But sometimes is just making sure that one understands that person, listening, making sure that as an individual, you try and address their issues, and using those kind of interventions, assessments, therapeutic interventions, for example, and helping them to go through. I know it's very difficult. Sometimes people don't want to talk to other people about their sickle cell, but it is important, even if it's just one person, like a one friend or something, because everybody needs somebody to help them at some stage. And if family members are not available, or if for any reason, you think that you can't even talk to family members, you just have a friend, at least one person that you can talk to. Sometimes I have people coming to, um, my psychological clinic, for example, and there isn't really anything specific that I will be doing, no specific intervention specifically, but they just want somebody outside their family to talk to. Just talk about anything. And I make myself available for that. So we could be just sitting in the clinic room and just talking, and you'd be surprised how people just benefit from that.
Yeah.
And when I ask them what makes you want to come and talk to me, because they'll just say, you are somebody outside the family, you can listen, not judge, and that on its own can make you feel better.
Yeah.
And then I will suggest to them that apart from me, I'm sure you could maybe find one friend who could also be somebody outside the family that you could talk to, that also helps.
Yeah. Yeah, I think that's really important, having that someone, and especially coming to someone like yourself that has the knowledge and understanding of the condition. Can Just that knowledge alone of knowing that you're aware of what could happen is really comforting.
I'm glad you said that, though, because I think within sickle cell, that's one of the things that, um, in dissecting this, it's one of the things that's lacking. It's one of the areas that's definitely lacking in terms of, we've had a discussion on how we're fearful, how we can go into depression, anxiety, and all of these things are literally just, they just happen. So whether a patient can identify that this is the actual name of what they're experiencing or not, I would like definitely want to say I could guarantee that they've experienced some form of this, and that speaking to someone or getting the support can
Mm,
make the journey and the experience a whole lot different.
mm,
But unfortunately, sickle cell is so underfunded, and just no one there's lack of education and awareness of it. Not every area of the UK, of Europe, of the world has that kind of support available to them.
mm,
I mean, if we're looking just in the UK, it's kind of like a postcode. So you might be in this hospital and you're blessed to have Kofi and to have a conversation with Kofi, right? But then from if you're in Birmingham, where I grew up and was treated, I remember I had no one to speak to. I remember going through a number of different things, including, 16 acute chest syndrome, almost losing my life, having to be resuscitated and being discharged and sent home. And no one, that was it. There
Mm.
was no conversation. There was no, how are you feeling? There was no, do you know what happened? How have you processed it? There was nothing like that. So I've never, other than within the last 5 years, I've never been offered any support through the sickle cell service, through the NHS,
mm,
because of me having sickle cell. I've had to go and seek that help and support elsewhere. I had to pay for it myself, and that was only because it got to a stage where everyone around me realized that I wasn't okay, and even I realized I wasn't okay as well. And
Mm.
so to me, that's too far gone. It's too critical. It was, when you're just crying for no reason every day and you can't explain it now, it's too late.
You've touched on something quite interesting there. So, how do you feel culturally, and well, the whole community? How do you feel their attitudes towards sickle cell can shape your mental health journey. You mentioned about others noticing that you just weren't okay every day. Was that within your community? Was it just within your family? When you stepped outside, was it something that you felt was noticed by your community? Or did you have to
I
seek out members of the community for help?
I think how sickle cell is viewed, like culturally and within the community, might depend on where you're from. So I'm like from the Caribbean, and sickle cell is very common. Everybody knows about it. Some people just have it and don't even mention it because it's not that much of a big deal. But I was never told not to talk about it. Whereas I've spoken to other people living with sickle cell who come from like countries in Africa where it's like, don't speak about sickle cell, don't call the name down on you. Then you have religions where it's like, don't speak it into existence, or, we can, if
Exactly.
you,
Big stigma.
yeah, it's so varied across different cultures.
Mm,
But I think where we are now is that mental health is being recognized more. And so I think it somehow, whether it's sickle cell, whether it's another condition, I feel like because more people are talking about mental health, maybe that in itself is becoming more accepted, and people
mm,
sharing how they're, there's a lot of things for men being more open about their emotions, and things like that. We have mental health awareness days that more and more we're seeing being like celebrated and acknowledged in certain communities.
yeah.
For me, was my family. I think it's so weird. It was probably those further away from me that noticed it first, because with my immediate family, I tried to hide it. So you
Mm,
you kind of know who's going to be on top of it, right? So I need to make sure that if these people come around, then it's fine, or if this happens, that's fine. But then at work, I'm not thinking about hiding my feelings. I'm just doing whatever I'm doing. So someone might say, oh, Jen's acting a bit weird, or Jen was late, or these little things that are very unusual.
yeah.
They're picked externally first, and sometimes it's just the simple "Are you okay?" that someone would ask me if I was okay, and I'd just
Mm.
cry. Completely loaded question that is, but those kind of things came. I would say it was recognized externally first, and so this is why I think communities and any parts of the community, whether you've got it, whether it's ESCF and you're a member organization, or whether it's friends, family, or just community centers, whoever you're seeing, it's so important, if if someone has sickle cell, just to ask how they're feeling, ask how their week's been, ask how their weekend is, because you kind of never know how it's been. You don't know the answer to that question. They might have left work on Friday, admitted themselves into hospital, spent the whole weekend, discharged themselves on Sunday to get back to work on Monday, and no one asks how they felt, so no one ever knows that that's what they did. So I think for anyone who might know someone who has sickle cell or anything like that, just ask. Just
That's the
asking is
question.
enough. It makes a big difference.
Yeah. And Kofi, can I ask, what do you feel might be some of the misconceptions about mental health needs of those that are suffering with sickle cell?
I think it's very interesting because up until today, um, having been around for a long time, up until today, you would still meet, and these are health professionals in training, for
Mm,
example, like doctors in training in medical school, and they would ask you, how does I mean, like, what do you do as a psychologist for people with sickle cell? I mean, I thought it would be something so obvious, right? So I think the the issue about mental health, I think, is getting better in terms of people talking about it. But interestingly, when sometimes you have to relate mental health broadly to something as specific as sickle cell, um, then you want to um, make people understand what the the key issues are. And one of them you just Jen's touched on, just talking about it in general, the stigma that comes with it, and that stigma could be two things, like sickle cell in general, as well as mental health in relation to sickle cell. That is like a double, sort of um, problem. So I think it's just making sure that we can use mental health as a means of making people understand that even when you have a chronic condition like sickle cell, um, the impact of sickle cell on people's day-to-day lives
Yeah.
is something that would affect their mental health, emotional well-being as well, and that obviously needs to be addressed.
Yeah.
And as Jen has also said already, we don't have enough of that psychological support in place.
Mm.
And unfortunately, sometimes people um, may be referred inappropriately as well, uh, to, let's say, psychiatrists without necessarily um, knowing that that might have a negative effect, as opposed to maybe a psychologist who would look at it from a different point of view, and just in terms that um, if somebody is depressed or anxious, they may not necessarily just need medication. They just need some sort of talking and some sort of emotional support from that point of view.
Yeah. And if you were to provide any sort of feedback for how mental health professionals could better support people living with sickle cell, what would be um, your first thoughts?
First thought is that basically they need to be educated about sickle cell. I mean, that's so fundamental, because you know obviously different conditions affect people's mental health or emotional well-being.
Mm.
So you need to know about sickle cell. So that will be, and that is why straight away, when people are referred to, um, let's say, even psychologists or mental health professionals who don't know much about sickle cell, you know, people are not comfortable,
Yeah.
because you don't want to spend all your time trying to educate somebody who's supposed to be a professional
Yeah.
about your condition, and then not getting a good outcome out of that. So that would always be the start. And that is why it's important that regardless of wherever, in terms of which part of the country you are, you just want to make sure that even if people are working in a way that in terms of funding or whatever,
Mm.
it's not sufficient. You just want them to know that you know um, they can trust you, because they can get empathy from you. And also, I mean, I never stop learning from people that I see,
Mm.
because like I said, everybody to me is an individual, and their circumstances might change even in time. Somebody that you might know um, earlier on might have different circumstances. So I'm willing to listen and making sure that I'm understanding them for that particular time that we are sort of talking, as opposed to what might have been previously. So I think that is quite important.
Yeah. And Jenica, how can mental health care professionals better support people living with sickle cell from your perspective?
I think the first thing I would say, whether this is for professionals or patients, is this is my belief. Kofi might have a different view or maybe agree. But I feel like when it comes to the mental health support, it's something that both the medical professionals and also the patient should actually realize that I think it should be ongoing. And the reason why I say that is because I remember sharing with someone that I was, having therapy, and they had been through, I think it might have been marriage counseling or something, that they'd been to therapy before, but you have some of these, like I've been to ones where it's like it's for 6 weeks. And at the end of the 6 weeks, somehow you're supposed to then have the tools to to go on in the world, or 10 weeks. And unfortunately, I think, whereas for some issues or whatever it might be, some life situations that might happen where you think, you know what, I need a therapist for this, and they help you to get through it, and you go through it, you get through it, and it's done. We live with sickle cell, it's not going anywhere. And so every day there's something else that happens, every week, every month. And so I might speak to my therapist for 2 or 3 weeks and I'm fine, and we're just having casual conversations. But then something happens where I feel like, this is related to my sickle cell. And I was trying to explain to this person that there's no end goal. Like, I don't think there's an end result. I think the goal is to just be able to live with it. It's kind of like tools of living, and there's always going to be something new. Like Kofi said, he's constantly learning. I think it's the same for us. We're constantly learning. So it needs to be ongoing. And I think these, 6-week programs, 10-week programs, unfortunately, I don't think that they are useful for us. And sometimes I would say, in my own experience, can be more detrimental, because just when you get to a stage where you might be opening up, or you might have, opened a can of worms, so to speak, your time might be coming to an end, and then you kind of just you've finally got to a stage of feeling open, and getting to the root cause. And then it's like, well, I've given you lots of tools, that just apply what I told you in the first 2 weeks to whatever else happens.
I think what
I think I agree that but it goes back to the issue about
Education.
not having the appropriate funding. Because ideally you should just have psychologists as part of the team that is looking after patients per se, and the multidisciplinary team, if you have a psychologist who is always around. Because I say to people all the time, for me, there's no formal referral process, and I don't discharge anybody, right? Which means that everybody has a chance at any time just to talk to me, and as much as possible, I'll try and accommodate. Because, like you said, sometimes you just need somebody to talk to for just a couple of times, and that'll be fine. And sometimes you just need somebody to talk to from a psychological perspective, for a longer period of time. So I think if we could fund, psychology in the way that is appropriate for exactly how you've described it, that would be the best.
And I think what I hear from what both of you have said, I don't hear so much of disagreement, is what is needed and what's really essential is individualized, respectful care. So it's not necessarily everybody being the expert, but maybe just taking the time to listen and respect the patient's experiences and what they're telling you, because they will always be the most qualified one to discuss how they're feeling and what they've experienced. So that's my takeaway from what you've both said, that it just needs to be really individualized and respectful.
Exactly. And knowing that somebody's needs might just change
Yes.
From time to time.
Yeah, and that's it.
Yeah.
Just knowing that we're individuals, I think it's something that we see a lot as well. Is you might have met one person living with sickle cell, and you think you've met them all because you've treated 1 or 10 or 20, and it's like, we all have different journeys, we all experience it, we all deal with it different, we all have different complications. So just realizing that we are individuals, what I might want to talk about might be completely different to someone else, and what helps me might not help someone else as well. So I guess if we do get the funding and get the support we need, it's then getting the right people in that support, that have the education, as Kofi said, but also have that understanding of that individualized care as well.
Yes, perfect. Well, thank you both so much for joining me today. It's been a great conversation. I hope that the future podcast will continue to elaborate and expand on everything that we've been discussing. And to everybody else, please keep watching. There's lots more great things to come. But for now, thank you and take care.
Thank you.
Thank you.
If you have been affected by any of the topics discussed in this episode, please reach out to the European Sickle Cell Federation so we can signpost you to the relevant support services in your country. Our email address is office@escfederation.eu.